Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the Pelosi health care bill is now in the Senate. Carolyn Scanlan will analyze, then Robert Swift, one of our favorite reporters, is in the House. He's going to talk, a legislative update? Where are they? What has the legislature been up to? And then our popular financial literacy update, a full 30 minutes of nonstop commentary. See you in a moment.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, Carolyn Scanlan is here to analyze. She's the president and CEO on the Hospital and Health System Association of Pennsylvania, one of our frequent guests who comes on to analyze healthcare issues. All right, Carolyn, listen to this. I was in Florida, did a couple of speeches over the past weekend, and I learned something that I was stunned at. Now, we know that people show up in your hospitals and they say, I'm sick, whatever it is, treat me, and you treat them. Did you know that people were coming from other parts of the world into Florida in this case? The first stop is the hospital for a medical checkup or some health care. They're coming to our country and going right to the hospital. Explain that to me.
Well, you know, we have, by any measure, one of the best healthcare systems in the world. And people who are coming from countries that don't have that kind of level of health care, where they can get some basic health care but not high-level health care, do come to the country seeking care. Now, in some instances, like in our state in Philadelphia and Pittsburgh, we have people coming from worldwide to seek the kind of tertiary or quaternary care that's delivered.
But they come because they may have a particular medical problem. You know, may go to Children's Hospital if you've got a kid or some where there's specialties. But this is like people will come here, even if they're on a vacation. I mean, they stop at one of our. And now I'm going to go to. Who pays for this? I mean, isn't that at the heart of one of the aspects in the bill?
That's this issue, and so we all pay for it, and those of us who have insurance pay a piece of it in our premiums.
Right.
Medicare pays a piece. Medicaid, which doesn't pay full cost anyway, doesn't pay a piece. And then the hospitals absorb it as charity care or bad debt if the person isn't able to pay.
Yeah. All right. Well, let's turn now to a couple of other aspects of the bill that, you know, I'll call it the Pelosi bill, you know, came out of Ways and Means, and then actually there are three bills they merged in the House, and we're going to take care of two in the Senate. It's very complicated. From your point of view, I mean, you've spent a long time studying this. What do you think are the good signs? What do you see good in what is actually going on right now in this healthcare debate?
Well, I think there are a couple of good things that are in any of these bills.
Okay.
So hopefully make it all the way through to the end product. One is that we cover more people who are legally residing in the United States. Currently, 83% of those who are legally residing in the United States have some kind of insurance coverage. Under the House bill that passed, that number will go to 96%. That's pretty good. And the kind of issue that you're talking about, where people just showing up in an emergency department who aren't covered, won't have to be absorbed by the rest of us. The Senate bill, at least the latest finance bill, we don't know what will be in the final package, was at 94%.
Right.
So that's a good thing.
And American people generally favor that in all the polls. We can debate public option, but they do favor extending coverage, and they're willing to pay in certain ways for it. But go ahead.
Yes, so that's a good thing because, as we've talked about in the past, if people don't have insurance, they generally don't seek wellness care or preventive care, and when they finally do show up at a hospital, they're sicker than they had to be or should be because they weren't getting care.
That just adds additional healthcare costs
for that person and for the system as a whole. The other good part, I think, that's in all of the bills is some insurance reform. And so the ability of anyone to be able to buy insurance individually if they're not covered by an employer, if they have a pre-existing condition. And that's pretty significant for a lot of people.
And not only the pre-existing conditions, but across state lines, you know, that's another debate. That will help make it more competitive and, in theory, lower cost, do you think?
I think so, particularly in a state like Pennsylvania, where we have some pretty dominant insurers. You know, the view is a little more competition might be good for them, or good for all of us. There are also some other insurance reforms on the insurers can't drop you or do a rescission of your policy. Plans will cover children up to age 26 for parents whose kids can't otherwise get coverage. The piece that gets a little more controversial, but I think is necessary in order to spread the cost of insurance, is that everybody will be mandated to have insurance.
All right, we're talking with Carolyn Scanlan. We'll be back, healthcare, and then Robert Swift's in the House. We're going to chat about legislative matters after these words.
This broadcast of Pennsylvania Newsmakers is sponsored by Citizens to Protect PA Jobs. When businesses add jobs, people prosper. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. Carolyn Scanlan is with me, one of the experts who comes in from time to time, knows as much about this healthcare stuff as anybody I could think of. Carolyn, let's talk a little bit about the public option. Man, what a lot of controversy. Now, the House bill, they say, well, only 3.5% of the people would actually be involved. And so the critics say yes, but it's the Trojan horse. Soon it'll drive out competition and be, you know, a new program, a new huge government-run program. Give us your take on that.
Well, first of all, we have a whole bunch of government-run programs already, so I'm not quite sure why people who support a public plan think it's necessary for competition with private insurers. We have Medicare, we have Medicaid, we have
S-chip, or whatever it is.
The Children's Health Insurance Program, we have the VA system. So it's not as though we don't have public plans.
Right.
But this one doesn't seem to make sense. I mean, there are enough choices for people who want to buy insurance to be able to buy it, and with the kind of changes to insurers and what they have to do, that should be a reasonable way.
And you think if they open up the insurance market to more competition, that would exist without having them compete with the public?
I think so. I mean, we're going to create a virtual marketplace, these things that are called exchanges.
Right.
And you'll be able to look on the computer or somewhere to see all the insurance companies in your area and what they offer.
Do you think it's a Trojan horse for eventually driving the private insurers out? You know, that's what the critics say.
And you know,
it's something to consider.
It's not
anyway.
without merit. It's not. I mean, there is some merit to thinking that if you start with this, you can expand further. But there is a view that not many people would choose this as an option anyway.
Yeah. All right. Let's talk. I want to talk a little bit. I want to talk a little bit about cost here. One of the things that keeps coming up is who's going to pay for this, and we're in a recession, and some critics say, gee, you know, here we are, we're going to put these taxes on small business folks, the engines of job creation in our country, and that's maybe, if we, you know, good or bad idea.
Well, you know, in order to pay for this bill, and by, when I say this bill, the bills that are out there, there's a range of them.
Right.
It's anywhere from $900 trillion to 900 billion to 1.2 trillion, whatever. I mean, those numbers get meaningless after a while. But there's sort of a tax or a contribution by everyone.
Yeah.
Hospitals over the 10-year period will be contributing or losing payment of $155 billion. Now, from a hospital perspective, if more people get insured, some of those cuts may be offset by increased revenue from the insured. For a small business person who's trying to compete in the marketplace for a skilled worker, perhaps a mandate that they have insurance or they pay a tax takes a little of that competition out of how they attract an employee.
Yeah, the other criticism is that what will happen is if the penalty or tax isn't high enough, they'll just drop. You know, if you don't provide, it could be that they'll just say, okay, I'll pay the tax, you all go into the public option, and it'll be cheaper. And the same could be true for young people where they say, well, the immortal ones, you know, the 18 to 29-year-olds, the immortal ones say, I don't want it. You give me I'll pay $2,000 as opposed to $5,000 or $6,000. And so instead of getting the healthy people in the pool, we'll have more unhealthy people, just to put it that way. But that is go ahead.
But that is the issue back on the public plan, and why some people think it's the beginning of a nationalized system.
Right.
Because if you let individuals buy the public plan, you let small businesses buy the public plan, and in the House bill that just passed, you let large businesses have their employees buy in that way. You have more and more people buying it.
Yeah.
You know, there are There are pros and cons to the contribution by the employer, both small and large. In the end, I weigh to getting more people insured is the better solution.
All right, great update. We'll have you back when we got the Senate to deal with. Who knows, that could maybe go into the new year where it's not clear yet. Senator Reid has said he may even try to have a vote as early as next week. We'll see if that happens or not. We'll be back. Robert Swift, the legislature. We're always interested in what our friends over on Capitol Hill are doing. Robert Swift's going to tell us following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Welcome back. Robert Swift from Times-Shamrock newspaper is going to do a quick legislative update. Okay, Robert, here we are. 5 weeks ago, they went out for the election. They came back a day, at least the House did, day and a half. Are they meeting?
They're sort of straggling back. They are starting to take up some new issues. They're still trying to deal with some. There's still unresolved budget issues like the table games.
Where does that stand?
That's in this torturous negotiation between the House and Senate over, tax rates on for table games, for licensing fees, and what the different categories of casinos, what they can and cannot do.
So let me go to the bottom line here. They have been trying to get this worked out for months now, the table games. Some say they need the $230 million to balance the budget and to free up the state-relateds, Pitt, Penn State, Temple, Lincoln. No state money yet, correct?
Right. So, they're all sort of linked together politically. They're all hostage to each other. Once again, table games is something people thought would have been done 5 years from now. But because of the budget, it was in September. It really surfaced as a real thing. So they are trying to do something that normally would have taken longer. But at the same time, as Governor Rendell points out, the issues it's not philosophical issues on this thing. It's more
money.
Yeah, it's money.
It's always about money. All right, but bottom line on this, it looks like no deal soon.
Well, there's no deal yet. Both chambers are in this coming week, and we'll see if something happens.
Okay. Now I want to talk about a big thing. Texting ban has come out of a House committee. It would make it illegal to text while driving with a fine. Prospects for passage, texting alone. Now I know there's some other issues. What's your sense about that?
This is something that's being built. A lot of people are interested in this bill in the public. You hear a lot of comments. This is something that's being built as a House Democratic-Republican compromise involving the leaders of both caucuses in the House, which is something unusual these days after the budget. So that argues for its success in the House. Once again, one component, all drivers would be affected by the ban of texting. This would affect younger drivers under age 18 with use of cell phones plus any other, mini computers.
So let me get this straight. Texting everyone, 16, 17, whatever the actual age is when you get a permit, up through 18. A cell phone ban on them, but not on adults.
No cell phones and no texting.
For 16 to 18. But over 18, no cell phones. That would be excluded.
You could still use cell phones.
Now wait a minute. There will be efforts to amend this bill to include cell phone bans. Yes or no?
Some of the key sponsors of the cell phone bill in the House, Josh Shapiro, are on board with this compromise, saying this is what we can get. This is the art of practicality. But it would be likely there would be amendments on the floor. Now, the bill came out of the Transportation Committee, no amendments, unanimous vote.
Unanimous vote. So you would think at this point there's strong support for a texting ban. This is a big deal.
This is
a big deal, isn't it?
This is something that the chairman, Markosik of the Transportation Committee said, this is the law trying to catch up with the technology. The technology's advanced and we're trying to
I'll tell you what, let's be candid. Everybody who has a cell phone and who texts at some point or another has probably done it. It's dangerous And as you well know, it's a very widespread practice.
Right.
And they did some studies, so they know it's pretty widespread, right?
Yes, and this would require PennDOT now to get some actual reporting of in accidents if texting or cell phone use.
So we would know for sure,
yes.
and there'd be a fine. They'll argue about the fine, the severity of the fine.
This is a primary offense, unlike seatbelts where you can only be charged if you're doing some other violation of law. If a cop sees you, he can charge you.
Yeah, okay, finally, before I let you go, it could be that when this airs, there will be bonus gate indictments. We don't know yet who will be indicted. We know that some people will be indicted, and the date uncertain. But make no doubt about it, when they occur, it is going to rock the Capitol.
This is going to be, the era is heavy with speculation. This is going to be a major event. This could make the previous indictments of the, former House Democratic leader Mike Fionn look to be of a lesser impact or import if this thing comes down as what people are speculating about.
All right, Robert, thanks for coming in. All right, when we come back, financial literacy update time following these words. Stay here.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy. And by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hey, welcome back to the program. Financial Literacy Update. It's that time. Sitting across from me is Peggy Bosma-LaMascus. Do I got that right?
That's correct.
You see that? I got a name right. She's the CEO of the Patriot Federal Credit Union in Franklin County. Good county, by the way.
Thank you.
And who's this guy? Mike Wishnow is back from the Senior VP with the Pennsylvania Credit Union Association, one of our regulars. Financial Literacy Update. All right. Michael, I'm gonna get to Peggy about federal legislation, but I want you to give us an update. We've been very concerned about credit card and debits and use of it. We did this show a couple weeks ago, which was a huge show for us, in which we looked at all kinds of credit card fraud, partly because so many people are using debit and credit cards.
Absolutely, absolutely. Really, when you think about a model of efficiency, you could argue that the payment system, where people give a plastic card to a merchant and walk out with a good or a service, and it just magically happens.
Except when we get the bill at the end of the month, is that it?
Well, yeah.
Yeah, but the point is that by the statistics that you've given me, that there were more than 1 billion electronic payments over the internet, and worth an estimated $300 billion. I mean, that went from 15% of all payments in 1980, the year Ronald Reagan was elected. Only I would know that. Go ahead.
Well, no, Peggy, I mean, you see it in your shop.
Absolutely. And in fact, I remember what it was like before plastic cards, such as what we know them today.
Yeah.
And interchange is a real important part of making that very convenient transaction tool available to us. I remember when I was first getting into the workforce and getting out on my own, there wasn't such a thing as plastic cards such as we know today. You either paid in cash or you carried a checkbook around. And maybe you had a credit card or an account at a department store, something like that. But it was very labor intensive for them.
What's interchange? Is that the fee that merchants? Explain that for our viewers.
Interchange is the system of spreading out the cost or the expenses for the structure to allow us to use our credit cards, as well as a source of revenues to help offset the cost and the risk associated with the plastic cards. And it's been in place for, well, ever since way back when, like Bank AmeriCard and MasterCharge came into being.
So for our viewers, when you charge something, then there's a fee that would go to the bank for the use of the credit card, both debit and credit? Both?
That's correct.
Michael, why is this controversial?
Well, it's not controversial unless somebody wants to change it. And there are some voices in Washington that would like to see some of those costs reapportioned, so that
instead of just going to the bank, they would.
Well, that it would reduce what would come to the financial institution and to the card issuer, which would be Visa and MasterCard, and the merchant would essentially wind up paying a little bit less. Now, the problem with that is, right now we have a system that efficiently spreads risk and cost. We talked a couple weeks ago about fraud in the system, and really the risk of fraud is taken on.
It's with the issuer, such as a credit union, such as Patriot, and we're the ones who underwrite.
So you're on the hook for the fraud. Is that what you're saying?
Yes, yes. It comes back to us.
So you want the payment made to you because you're underwriting the risk. Is that basically the argument?
Yes, it helps us offset the risk. It also helps us pay the expenses associated with maintaining all of those accounts, the inventories for the plastic cards, the issuing, the mailing of the statements, and all of that. And it's a system that's been working very well, I guess, since the very time that 40 years ago.
And it's not been involved in any of this stuff going on with the Securities and Exchange Commission and investment banks. That's not really, Michael, that's not really been. I just want to make sure our viewers don't conflate, conflate those two into that. Well, then how much is the cost? I mean, there's another question. I mean, okay, you bear the cost and there's a fee attached. How much are we talking about here?
For a merchant, it may be somewhere in the neighborhood of maybe 1.5%, 1.6% to 1.7 or 1.8%, somewhere in there. It varies and it's negotiable depending on where they decide to do their clearings through.
Yeah, and we have about 30, but you would argue that these costs have remained static. They haven't gone up, so it's not like these fees have been going up, correct?
Correct. The volume has certainly gone up.
Well, sure.
So, the infrastructure's had to be enlarged, but no. I mean, the cost is essentially the same over the past 5, 6, 8 years, even as the volumes have gone up. The consumer remains protected.
All right, this is a good update. I mean, I don't think we've talked about this before, this aspect of it, I mean, about who pays for it. But at any rate, thanks as always, great update. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, you stay well.